It is our tradition at the final Power Breakfast of the year to invite intriguing people to talk about their new ideas, projects, and approaches for our region. Our first speaker today is certainly a fit. Patrick Brien began his career with the U.S. Army, where he spent a decade leading units in combat operations in Afghanistan. He later headed strategy for the University of Global Health Equity, a health sciences university in Rwanda. Patrick is now in Wilmington and backed by Live Oak Bank. He's working on a new concept for our region, collective impact. Please join me in welcoming Patrick to the stage.
Good morning. We're going to talk a little bit today about collective impact. We're going to talk about CFC, but first I want to talk to you a little bit about mindset. And in order to do that, I have to go back to Rwanda. I got to go back to the place I was before I came here to Wilmington. So before I came here, I worked for an organization called Partners in Health. Partners in Health has spent the last 35 years providing health care in some of the most austere conditions imaginable. Their sole purpose, their sole focus is to provide equitable health care access for the world's poor. And so the specific project I worked on was called the University of Global Health Equity. And this is the culmination of that 35 years of experience. And they went out to Rwanda, they went out to the hills, and speaking of Ellen, right, so Rwanda, if you don't know, it's where the gorillas are, right, but there's also some amazing health care going on there. And so we decided we're going to build on this hill, and we're going to do it across the valley here from one of the best cancer research institutes in that country. And again, this is a very novel concept, particularly in Africa, to have health care, to have such great health care facilities in rural areas. And the same goes for here too, but it's even more stark in terms of contrast at the global scale. And so we put this amazing, this innovative institution into the rural areas to train the next generation of global healthcare leaders. And this really goes back to the founding of PIH and the founding of the principles and how it kind of got started. It was started in the 1980s. By a guy named Dr. Paul Farmer. He was a young medical student. He'd just come out of Duke. He's at Harvard. He's traveling back and forth to Haiti. And he's seeing some things that he just couldn't stomach morally. He's seeing some things around, populations just not having the same access to the same services that others had in the cities, others has in the States, in Boston, and where he grew up in North Carolina. And so there's two key principles here I want to talk to you about today, and then we'll kind of ease into the CFC part. But this is the first principle, equity. Right? He found it completely so astray from his moral fiber that a life in one zip code would matter less than a life in another zip code, that a life in a rural area would matter less than a life in a city. And so he started PIH under this foundation. Now take a look at these words. They're super simple, but they're incredibly powerful, right? We go. We meet you where you're at. If you can't come to us, we will come to you, and we will provide health care in your home if necessary. We build health systems. Notice this doesn't say we cure disease. It says we build health systems. And then we stay. It's a partnership. It's an ode to community building. And so really this starts to come back to some of the first experiences he had in Haiti. He's a young doctor there. He's trying to do the best he can with little to no resources. He's trying to build a clinic in Conj. And he starts to see HIV sweep across the country. And he's trying to understand, how do I, in the tide, in the waves of this suffering, what can I do? And so he started to beg, borrow, and steal antiretroviral therapy from wherever he could get it. And at the time, he was a resident in the Brigham and Women's Hospital, and so I think a lot of things went missing there that ended up in Haiti. But he started to treat poor folks for HIV, right? And in this time, in the early 90s, when this epidemic's going rampant, this is a novel concept. It was not the policy of the U.S. government or the global health community to treat poor people for AIDS. It was considered fiscally unsustainable. But he did it anyway. And then he went out and he started to figure out that folks had HIV, but they also had secondary diseases because of their compromised immune system. So he started to treat for things like tuberculosis. And he realized that I can treat them for tuberculosis and I can treat them for HIV, but if they don't have food, they're not going to get any better. And at this point, the global health community kind of loses their mind, right? They call him irresponsible. They call him a zealot. They tell him that you can't spend money this way. And he kind of says, sure, and I'm going to keep going. And so then he's trying to figure out, as he's doing this, how do I build a system that is sustainable? It goes beyond us. It transcends us. And he's starting to look at the communities, and he's starting to realize that these communities are resilient. They're strong. The world's left them behind, but there's a lot of goodness there and there's a lot of capability there. And so he creates community health worker programs. And he starts to hire folks from those villages and he starts to put them to work providing health care to their neighbors. And again, think about this concept in the last 5 to 10 years. What have you heard in American healthcare? You've heard the social determinants of health, food, housing, et cetera, and you've heard community health worker programs. And we look at it as innovative here in the United States, but it's not. It's been around for 35 years, and it was created in places like Haiti. Because when you're focused on a single North Star, when you're talking about equity, when you're talking about providing equitable health care access, it wasn't about curing or treating HIV. It was about building a health system that would transcend generations. And so when you do that, innovation is spurred, right? And so as he kind of goes through this process and he starts to kind of work through how to do this, he starts to take on bigger and bigger challenges. And the impossible starts to become possible because he's not thinking with a finite mindset, he's thinking with an infinite mindset. And so they go down to Peru and they treat multi-drug resistant tuberculosis. People said he couldn't do it, but he built a system and he did. He goes to Rwanda post-genocide. He goes to the worst place in Rungwavu in Rwanda. Some of the best healthcare outcomes we've seen in our entire generation have happened in that single province in Rwanda. And so what happens is as you go along, as these systems build, right, he would have never thought in those early years as he's treating HIV, as he's building community health worker systems, that the front lines of healthcare in 2012 would be those community health workers when that earthquake completely decimated that country. As it sits in political and civil strife today, he never thought that those community health workers would be the thing that keep the steady state healthcare, the steady state prosperity in those communities going day in and day out. The rate in which change is affecting our community is it's so fast that if you're only solving finite issues, if you're trying to cure this disease or end this level of violence, you're not going to be successful. It's about building systems that look at communities as assets and not as liabilities. So with that mindset, with that experience, with that infinite look in terms of how we approach social progress, I landed here in Wilmington. And so what is collective impact? Collective impact basically is that community health worker system. It brings people together to affect social change, right? There's 1,000 organizations in this community, literally 1,000. That's not like a nuance. There's 1,000 organizations in this community who are doing great work. How do you get those folks rowing in their boats at the same speed, looking out left and right, seeing who's next to them, to the same outcome? How do we go from the left to the right? And usually what you see here is you see individual impact, you see coordinated impact with alignment and isolation, but very rarely do we get to that far right side of the spectrum. And a lot of that has to do with what's our common agenda? What problem are we trying to solve? Putting a grocery store in a neighborhood is a very different thing than trying to cure food insecurity in that neighborhood. And so we have to understand, what is the problem we're trying to get to? Are we trying to solve homelessness? Are we trying to build the very best homelessness response system this country has ever seen here in Wilmington? And so as you see, you start to posture these things with a finite versus infinite mindset. We start to think about these problems a lot differently. We start to solution a lot differently, and we start to become a lot more innovative. And so over the last year or so, I've hundreds of meetings. I've probably met with half this room. So this makes this easy because you guys are, well, half of you are probably reading the Business Journal because you've already heard this speech about 14 times. So 4 observations, okay? The first, as we came into this work, is there's already a lot of good work going on, right? You don't need necessarily a backbone organization to run collective impact on a specific social problem because that's already occurring. And so we started to posture ourselves as a backbone of backbones. We've taken a step back to say, how can we be the tide that raises all ships and lead from the back? How can I provide data science solutions, provide project management, provide fundraising capacity to support the organizations already in the field? The other observation is that, and you've all heard this, resources are low, but the need is great. There's probably some eye rolls in there I won't, tell on you, but it's true. All right, if you take a look at this graph, the first myth is that there's too many nonprofits in Wilmington. When we look at our comparison counties, that's just not true. 2, there is 10 times more resources in Forsyth County per capita adjusted for population than there is in New Hanover County. And when I bump that up against some of these poverty statistics, we're dealing with worse issues, if not similar issues, and we have a real problem with housing, right? And the trend lines are not getting better. Right here, today, right now, we're going to make a decision to say no more disparities in Wilmington, or we're going to choose to ignore it, and we're going to continue to see that gap widen, and that's going to hurt the economy as a whole. The third observation is the data needs to be actionable. Most of the data that the nonprofit sector works with is 2, 3, 5, 10 years old, right? As business leaders, someone's working with 10-year-old data and makes a huge resource allocation in your business, that person's probably getting fired. But as nonprofits, we're expected to live in that space every day. So how can we make that data actionable? How can I fail fast? How can I implement agile methodology? How can I do those things to allow us to catch up with the business sector in terms of how we implement? 4, equity must be our foundation. There's just some folks, like in Haiti, that need a bigger step to get over that wall, get over that barrier. There's systemic things in this world that hold people down. And if we focus on the 15 to 20% of our most marginalized citizens, we will have the greatest return on investment. Those citizens will make us all better. Just like in Haiti with Dr. Farmer going out and saying, you're the new healthcare practitioner in your village. And I have seen this happen in Rwanda. PIH employs 17,000 community health workers all over the world, and they are the heartbeat of those villages. So what's next, right? So you've probably heard some of this speech before, probably not the first time. I understand that. But what are we doing? So the first thing, we're going to go out and get the data. So we have a relationship and a strong partnership with UNCW. We're standing up a Center for Social Impact. Deans from across the university, from all colleges, have dedicated resource and faculty time to come together to take the data that we're looking at and to support us with that analysis. We're looking at about 300 different health and opportunity metrics. We break those metrics down by methodology, and we go out to local partners like the hospital and the school district and say, can you give us this data on a monthly basis so that we don't have to be 2 years behind the 8 ball all the time? Because of that, we spend a ton of time being ambiguously right and not enough time being precisely wrong. And so that our investments, we never understand where they're going or what they're doing until it's too late. And we usually have some semblance of public health data in the world, right? When we're in global health or we're here in the States and working, we kind of get it, poverty rates, et cetera. But what we usually don't know is how we're organized to defeat those symptoms. And so I mentioned there's over 1,000, I think it's 1,180 nonprofits in this county alone. We're going to go interview all of them. We're going to talk to them. Where do you play? Who do you serve? Where does your funding come from? Where does it go? Because once you understand what ails us and you understand how we're organized to affect those symptoms, then we can start a conversation. We can start to have a conversation back to community leaders like yourselves to say, what do we do now? And in the meantime, we're having conversations about advocacy. We're providing the administrative horsepower to allow nonprofits to focus on their day jobs, to continue to ease suffering. While we look to the future and look out, and we try to bring the world into Wilmington and Wilmington out to the world. So what does that look like for us? So we start with the investments in our core service areas. So first, data science. All right, that's a huge part of what we do. Project management. If you're going to organize 300 or 400 organizations, right, think Resiliency Task Force, New Hanover Disaster Coalition, the community's response to the opioid epidemic, right? You need a backbone organization to keep those trains running on time. And what we're saying is that we can do that at scale across all sectors. Because if we're going to fight systemic racism, we're going to fight systemic persecution of low socioeconomic classes, we have to build a system ourselves. We can't keep working in isolation. Fundraising capacity, you saw the numbers. All right, as we band together and we transition our data platforms from outputs to outcomes, we can go out for multi-year, multi-million-dollar grants at the national level. We can increase that $1,300 per capita and start to pour more resources into the community. We can also look at things like social impact investing. Everything doesn't have to be a donation. You can show an investor 7 to 9% returns on having them invest money and putting a kid through community college. I've seen it done. I've seen it done in the States, and I've seen it done in Ghana. All right? So there's other ways to think about fundraising. Advocacy and awareness. We're launching a podcast this week called Collective Voice. We're starting to have a different conversation. We cannot do this change unless we have a common language, unless we understand our history. We're launching Art for Equity 2020 next year. How do we get the arts sector involved? It's the arts that builds a movement. It's the arts that tell the story. So how do we get them involved into this social sector space, and how do we start to think about who we are and where we want to go? We take these 4 core service areas and we implement them at scale across all sectors. Again, you can't necessarily find the thing, right? It's such human nature to try to chalk things up in wins and loss columns, right? That's what we like to do. We like to keep it black and white, simple. It's not simple, it's gray. Everything's gray, right? And so how do we systemize against that? How do you operationalize equity? And so what we're saying through the data collection and through this broad approach, what we're saying is that thing will bubble up. We can fail fast. We can iterate. All right? Some things will jump on that initiative. That initiative will power down. That's a good thing. Working ourselves out of a job isn't bad, right? Especially in the social sector. We create value through that, right? Efficient resource allocation. Yes, I can go fundraise for that money, but also if I can leverage things like churches, of which there's about 140 faith-based organizations here in this county who are doing great work every day, can I bring $2-3 million in value out of that while I start working on my long-term fundraising strategies? Data, predictive analytics. How can we start to look out, use AI, use machine learning to start to think about, if I bring this child into this environment, what are the chances he or she gets to the next level, right? What is the cocktail of social interventions that works best? Again, systemic, that fundraising piece, and that marketing piece. How do we tell the stories of the good work that are going on in our community? And it's not just nonprofits, right? Quenisha Mullins is sitting back there from Creekwood. She's a community member. I've seen her do amazing things with very little, right? And that's happening every community we go to. We find someone who cares, right? How do we tell that story? And then we talk about ROI and social ROI. It's not just hard ROI, but it's also how does the community benefit from this approach, right? And so how can you get involved? What's the ask? One, if you're working in the nonprofit sector right now, keep doing that. If you're volunteering, donating, serving on a board, keep doing it. And if you could do more, do more. I have never been in a community that has a nonprofit sector that does so much with so little. They are scrappy, they are passionate, they have huge hearts. Keep leaning in. Listen to our podcast. Follow us on social media. That sounds like a trivial thing, but we're really trying to build a movement here. We're trying to have a conversation with you, right? We're trying to tell stories. The first episode talks about collective impact. The second episode talks about hunger and food deserts. And as Joe Conway would call them, food swamps, right? We want to have that conversation. You're driving downtown on Market Street. There's a lot of things happen on either side. Let's talk about it. It's all our community. I've got no shortage of ideas. You can ask anyone that knows me, much to the chagrin of my staff. We've got things that we need your help with. As business professionals, we can use you. If you want to get involved, volunteer your intellectual capital, we'll take it. And we'll make sure that that time is well spent and you can get back to that day job. And finally, help us network. I've got to go interview 1,000 nonprofits. If you know someone who's in this space, if you know an organization, if you're on a board, if you know about a movement, if you know about an initiative, please let us know. Changing the world is a team sport. We're not trying to lead a movement. We're just trying to join one. And we hope you will too. Thank you.